Hey there, welcome back to EMT Chapter 31, Environmental Emergencies. When I took my instructor coordinator course, my instructor said that you should never let people know when you don't like a chapter. I've always taught empathy for my patients and for your patients, and I think empathy for students is important too. This is one of those chapters that it just sucks the life out of me. It's not the material so much as just how it's presented, kind of the details they go into. So I have to motivate myself. And I know that this chapter affects students the same way. You know, I just did a homework project for this class that I'm doing now, and it was find one thing in environmental emergencies, just do a little bit of research on it. What's the latest thinking on it? What's the latest treatment? Are there any changes? And I saw everything from environmental emergencies are bad to, hey, can I do dive, right? So there's that whole range of apathy towards it and excitement about parts of it. And the way I motivate myself is that this is not really for our patients that we're called 911 for. To me, this is about recognition, prevention for those that we work with and care about. You know, we go to fire standbys and everybody wants to watch the big red trucks and put the wet stuff on the hot stuff and all that bullshit, when really what we should be doing is rehab. You know, we should be assessing these firefighters as they come out of the building. Every two tanks, right? Every 30-minute tanks, two of them, you need to go through a formal rehab so we can identify emergencies. Because not just are we identifying environmental emergencies because, they're going from 800 degrees inside, sweating their backsides off, working hard, to now it's 20 degrees outside, but also the underlying comorbidities that they may not even know they have that get brought on by these environmental events. So here in New Hampshire in the spring, we chase brush fires every day, all day, from like March 20th to about June 1st, right? And it's 50 degrees out and our feet are wet. And we're working hard. So we're down to a cotton t-shirt and one of the yellow forestry shirts, right? And we're sweating our backsides off, but our feet are wet and it's 50 degrees and it's cold water. And we get trench foot and don't even recognize it. Or we get hypothermic, or, well, they can't have a heat emergency because it's only 50 degrees out, right? So this is how I motivate myself for it. And because so many of us in EMS either do standbys or we are on fire departments, whether it's full-time or call or volunteer, these are people we know and love around us. So as we go through it, I'll kind of point out what's really important, both for recognition and treatment. And then, well, this is kind of that silly test question type thing, okay? But keep in mind the majority of the time, who we're going to apply this to. I've been out on very few hypothermia calls, true hypothermia, 85 degrees, very few, okay? But I'm around people almost every day who are at risk for it. So exposure to hot and cold is the same, okay? When we talk about conduction, convection, radiation, evaporation, and respiration, it works the same way. Conduction, if you sit on something hot, you will get hot. If you sit on something cold, you'll get cold, okay? Convection, if you're staged in front of a hot air outlet at a factory, you're going to get hot, right? If you're sitting around an exhaust because you're cold, you're going to get warm and you're going to get CO poisoning. And that sounds stupid, but I lost my mind a few years ago at the training I was at, cold water training, 2 fire departments, one of which was mine. They're all huddled around the exhaust on an engine like it's a campfire. Meanwhile, in the ambulance right behind him, my CO detector was going off. Okay, so dumb things happen to good people. All right, so anyways, conduction, right? Convection, air and water running over you take away heat or add heat, right? Hot air, gain heat. Cold air, lose heat. Wind chill factor. Radiation. This is your cat who is lying in the windowsill in the sunlight, right? That's radiation. And it can be hot or cold. Evaporation. Evaporation is there to cool you off. Okay, so when you sweat and perspire, or sweat or perspire, same thing, right? As that evaporates into the air around it, the surface under it cools off. You walk through a misting fan. That water is on you. As it evaporates, it cools off the tissue under it. When it gets too humid outside, you lose the ability for evaporation to occur. All right. So in New Hampshire, there's a couple of days a year maybe where that dew point is that high. You're in Alabama, Georgia, Florida, it's a good portion of the year. So you have to keep that in mind. Respiration, right? We exhale hot air, right? Our metabolism, aerobic metabolism, uses glucose for ATP and it breaks it down for energy. The byproducts, the waste products, the trash from that chemical event is carbon dioxide, water, and heat. Okay, so we exhale some. We can also get cooled down by breathing in cold air. And the other thing cold air can do, by the way, think about this with your respiratory patients, is you take them outside to go to the truck, and that first breath of 10-degree air, they can bronchospasm. Okay? So cold air. So just a nice little diagram on it. Right, if it's cold, it'll make you cold. If it's hot, it'll make you hot. So exposure to cold, general hypothermia. Remember, our body temp is 98.6 degrees, right? That's textbook. A difference in 20 degrees causes this loss in body temperature. Your body starts to not be able to make up the difference. So you need a jacket, right? It's 75 degrees out. Most people, oh, I don't need a coat. It's beautiful out. And other people are like, God damn, I'm cold, right? Because some of that depends on how much body fat you have, right? Bigger people have more insulation, right? I've lost 150 pounds. I have a lot less insulation than I always had, that I was always used to. So now I'm always cold. You know, if the room or the outside temperature is in the 60s or 70s, I'm cold. I'm wearing a hoodie. Oh, I'm wearing a hoodie, right? So body structure plays a part in this. Your underlying health, right? Medications that you might be on certainly play in that. If you are hurt, your body is trying to fix things. So like trauma patients, they get cold quick. They can't maintain their body temperature. The very old and the very little, right? Alcohol. Oh, I'll have a sip of whiskey. That'll warm me up. And that sip of whiskey becomes a pint of whiskey, right? And it slows your metabolism down. So alcoholics who are, you know, that stereotypical homeless alcoholic. Not all homeless people are alcoholics, and not all alcoholics are homeless, obviously. But you know, people wander off. They're at a party, they wander off, and they pass out in the woods, right? Overdoses, poisonings do the same thing. Major trauma I just talked about. Outdoor resuscitation. They're walking from their car to Walmart to pick up their prescription or their coffee or whatever, and they go into VFib. And we're working them outside and it's 40 degrees. We're working our asses off, so we're sweating and hot. They're lying on the cold ground dead. They're becoming hypothermic. Right? And, you know, what is the temperature? What's the temperature out? What's the temperature in the room? What's the temperature in the ambulance? What's the temperature outside? Older adults. This is a great example. I go to a cardiac arrest one morning. It's like 5:30 in the morning. 80-something-year-old female, cardiac arrest. Right, we've got to cut her shirt off, her nightgown, her nightshirt off, so we can put defib pads on. Well, I cut off her pajama top, and there's a thermal shirt. I cut the thermal shirt off, there's another thermal shirt. So I grab a bunch of layers and I start cutting, and all I see is red, and I thought, oh crap, skin, right? Nope, she had 7 thermal shirts on. This house was normal temperature, 68, 69, 70, whatever people keep them at. Older adults tend to be cold, right? We walk into these houses and, new EMTs, you're going to learn it. You're going to find out. They get the heat cranked. It's 95 degrees in the house and they've got a sweater on, okay? Now, economics plays a part in this. Fixed incomes. They don't have the money to keep their rooms as warm as they would like. Or maybe I can't take my medicines, okay? So they're kind of living on that hypothermic bubble all the time. And they get a little sick, they get a little whatever, a little worn down, a little tired, and they get colder. With kids, their skin, our skin, human skin is the largest organ that we have. And for kids, it's exponentially larger. And they have, even that chubby little kid has less body fat, because while he might have chubby outside fat, as we age and we get fatter, we also build fat on our organs. So like when the surgeon went in to do my bariatric surgery, he had trouble moving organs around to get to where he needed to make the cuts, because there was more fat on my mesentery, my intestines and my stomach and all that stuff, than he was expecting. Okay, so when you have this weight loss, you lose fat on your organs. Little kids haven't had time to build that fat up on their organs yet. Okay, so even if they're a chubby little kid, right, and their neuromuscular capabilities do not allow them to shiver yet. Okay, we start shivering in early stages, and think about what shivering is. Shivering is muscle movement, right? This is your musculoskeletal system moving, and what this movement does is it creates an increase in the need for energy. So the cells increase the metabolism to put out more energy. Okay? So when we do that, we create more energy, we create more waste products, water, CO2, and heat. So we're exhaling heat. Hey, and we're getting warm. Okay, so we're giving off heat as a byproduct. Then we go to numbness, a little bit of loss of senses, right? You can't feel things as well. Oh man, I can't, my fingers are frozen. I can't, they're numb. I can't feel my car keys. Okay. I'm having trouble with my zipper. I can't get my freaking jacket zipped up, right? Then stiff, rigid muscles, like 98 degrees. You get, you get too cold and you get stiff. You think about these football players who after a game, they go into an ice bath to reduce swelling. Well, think about going into a cold lake, right? It's June and you jump in the lake and the water temperature is still 55, right? And you come out and you're kind of walking really stiff. Then drowsiness. Then we start to see vital signs. Breathing really fast or really slow. Really fast pulse or really slow, right? They climb first, and then as we reach failure, respirations and pulses start to drop. Motor coordination, you can't zip your coat up, right? Everything's stiff and rigid. Unconscious, cool abdominal skin. So when you have this dude who's hypothermic at say 90 degrees and you touch his fingers, man, his fingers feel like ice, his feet feel like ice, right? I can't get a pulse ox reading. But if you touch the core, the chest or the stomach skin, that's going to be warmer, because the body is vasoconstricting to the extremities to keep that blood, to try to keep that warmth in the core for the major organs. So as that advances, then that core blood starts to cool off too. And then what you can get is just this loss of vascular tone, loss of precapillary sphincter tone, and you get just this flushing of blood out to the extremities, and it might look red at that point, or it could be pale or cyanotic. As far as warming them, we have passive and we have active. So passive warming is we're just covering them, get them out of their wet clothing, which might be sweat or it might be from the river. Okay, it might be from the snow. Get them out of the clothes, get them right down, buck naked, underwear, socks, everything. Cover them. Let their body, especially if they're still shivering, their body will do well. Their body will manage that well, as long as you get them out of the wet clothing and put something warm around them to insulate them. Especially if they've stopped shivering, you got to start thinking about active rewarming. Now, you can take this passive rewarming and kind of, I think of it as kind of a blend. It is truly active, but you have these big heat blankets, and they're like the hand warmers, only there's, I don't know, I think 27 of them. You rip the bag open, you shake this blanket that's full of these hand warmers, you put a sheet around the patient to protect them from the heat, then you put this thing around them. Some people they will cover up. Well, you're only getting one side, right? If you've got somebody laying on a stretcher and the mattress has been in the back of the truck in a 50-degree garage, that stretcher and the mattress is 50 degrees. Conduction, you're going to make them colder. So you put a sheet around the patient. I like to wrap a heating blanket around them from the torso up and another one from the torso down, put them on the stretcher, and then put blankets on top of them for insulation also, okay? Now, this is when people say active rewarming, this is more what they're thinking. But this is tricky. Rewarming the frozen part. It's supposed to be 104 degrees. I've seen 104, I've seen 105. There's a couple of things with this. How, in the name of God, in the back of an ambulance, do we keep this bucket of water at 104 degrees? Right? Because literally there's a foot-sized icicle or ice cube in that bucket cooling it down. If you cannot maintain the correct temperature over that period of time, you'll actually do more damage to the foot. Okay, so people think of this as active, whereas technically, if you think about that heating blanket, we're applying heat. Okay, so extreme hypothermia, unconscious, no detectable vital signs. Now, here's the thing with this. Any heartbeat in a patient with a extreme hypothermia, let's call it 78 degrees, right? Any patient with a pulse of 10 of their own is better off than us doing compressions on them. And what I mean by that is check their pulse for a full 1 minute, right? We know that don't delay compressions from 1 to 10 seconds. But when they're cold and dead or look like they're dead, it's a different animal. A hypothermic heart that goes into VFib will not come out of VFib until it's warmed up again. We don't have that capability to warm that patient that efficiently and that adequately in the back of a truck, okay? To take somebody from 78 degrees up to normal, we need not just heating blankets, but like the consistency of like a bear hugger, the hot air blankets that the hospitals use, Foley catheters and NG tubes with warm saline flushes. Some places use complete submersion, right? I mean, they keep their head and face out, but these folks are intubated and they put them into this 105-degree water, okay? So a pulse of 10 is better for their heart than compressions, because you can put them into VFib doing compressions. If there is no pulse, though, start CPR. Yes, go ahead and put the AED on them. Probably not going to work, though. And then go ahead and treat them as you would. A lot of protocols say that you should only shock them once with a defibrillator if they're hypothermic, because all you're going to do is more damage, because, again, the heart's not going to respond to it. You're not dead till you're warm and dead. There are lots of cases where people have been, especially in the water, specifically kind of water drownings, these especially kids, where they might be in the water 45 minutes up to 2 hours. They get pulled out of the water, they get resuscitated, they get warmed up, and they survive with minimal to no deficits. Okay. However, if you find somebody as the snowbank melts in April, the guy's been missing since November, and a snowbank melts in April, he's dead. Okay, don't start. I actually had a partner who got written up by an EMS coordinator because he did not start resuscitation on this guy who'd been dead for 6 months, because you're not dead till you're warm and dead. And here's your EMS back, my partner. Anyways, so warm and dead is different. Now, localized. Ears, nose, fingers, toes, penises, right? Most guys are pretty protective of that though, but fingers, toes, nose, ears, very commonly affected by this, because we have less circulation and blood flow out to these areas that have a lot of surface temperature. And as we get cold, our body vasoconstricts, so we limit the blood flow to that. Then, as ice crystals form, there's no exchange of chemicals, there's no exchange of blood, there's no exchange of fluid, okay? So you can certainly have ice crystals. So early, superficial. The old school for this is frost nip. Fingers are pale, cold to the touch, they hurt, like pins and needles, numbness, tingling. Get them out of the wet gloves, or whatever, right? Dry them off, get them out of the cold, and protect it. One of the best, if the patient's otherwise stable, one of the best areas to do is just have them tuck their hands up in their armpits, right? Because the armpits are nice and warm, and it will slowly, gradually bring those fingers back up to a decent temperature where internally we can now have warming as well from adequate blood flow, okay? There is no frozen tissue in this, okay? Late frostbite, right? Late deep is frozen tissue, okay? We need to cover it. We need to immobilize it. We need to be gentle with it, and we're mobilizing it to protect it. Because if you think about fingers being ice crystals, you bang them on the door as you're going out the door of the patient. You step, their hands are laying on the, that's fallen off the stretcher, is laying on the floor, and you step on the fingers, you've done structural damage to that little cellular ice cube, okay? So good picture of it. Back in the day, right, everybody talks about the day. So when I was a young parapup, back in the mid 80s, really the only treatment that people talked about for this was amputation. You've got no blood flow to those tissues. You can see where there's black and blue, and you can also see where there's just pale waxy white around it. Nowadays though, no, they treat it like a burn, and they'll do debridement of the dead tissue, and they'll do skin grafting, and a lot of times this frostbitten area does fairly well. So if I had a frostbite like this and I had my options within a reasonable time frame transport wise between a local ER, a trauma center, and a burn center, I'd probably talk to somebody about going to the burn center. Right? So with all cold injuries, get them out of their wet clothing. Remember that wet sucks heat. Okay, so get them out of the wet clothing. Dry them off. This is just like delivering a baby, right? Get it out of its wet covering, dry it off, get rid of the wet, cold towels, wrap them in warm, dry stuff, okay? ABCs, shock if they've got it. If they're alert, you want to feed them something warm, you can do that. Stay away from caffeine though, right? Well, we'll give them some coffee. Caffeine is a vasoconstrictor. Hot chocolate, caffeine, Those are the first, right? Hot chocolate has caffeine in it. Coffee has caffeine. You want to give them decaf? Sure. Warm soup, warm milk, whatever, right? But stay away from caffeine. Don't let them smoke. Nicotine is a vasoconstrictor too. All right. Whiskey is a vasodilator. Well, in the face, anyways, right? Because we see that with the nose, but don't give them any whiskey. That would be bad. And transport them, unless mild case, right? So they got a little cold. You know, they were out hunting or hiking. They came back to the house. Somebody else calls 911 because they're concerned about them, and you get there, and their body temp's 95 degrees, and they don't want to go to the hospital, and they're warming up. They've already changed into their dry clothes, and they're having a cup of soup, and 20 minutes later they're at 96 degrees and they're trending up, and they can refuse transport for all the correct reasons, right? They're alert, oriented, compliant, all that stuff. Okay, sure, but otherwise they should go to the hospital. Unresponsive, ABCs, right? High flow O2 would be good. Through a warm water humidifier. Nobody has these on ambulances anymore. We used to carry humidifiers in the ambulances. We don't even do that in New Hampshire anymore. And we never had warm heaters. Now, you might be in a place in the North Country of whatever state, along the Canadian border, or Southern Canada, or mid-Canada, Northern Canada, Alaska, Russia, whatever, where you have a lot of cold like this, and you may have heaters, warmers, and that would be great. People go, well, we'll wrap the tubing around a hot pack. It does not transfer heat fast enough to make an issue. And people say, well, we can do that with the IV tubing. We'll just wrap it around a hot pack. Doesn't work. Does not work. Okay. You need IV warmers, and if you're in an environment where this might be a consideration, a humidifying warmer. Wrap them up, transport immediately, crank the heat up. Now, wrap them up and turn the heat up. So let's say you can turn the heat in the ambulance to, most of them stop at 90, but let's say you can go up to 95 or 100, right? Their body temperature is 85. We're going to wrap them in a blanket, protecting them from the outside environment, which we're warming up. You got to play that by ear. If you can make the back of that truck into a sauna, I might not wrap them in a blanket. But it would depend on how cold they are and what their metabolism's doing. Okay? Seldom recommended as far as rewarming. If you start to thaw a frozen body part, you have to continue it. Otherwise, to let it refreeze, you'll do more damage. So you're doing a long carry out. Up in the White Mountains here in New Hampshire, they spend 4, 5, 6 hours carrying people, hikers and campers out sometimes. You're not going to be able to do that consistently for 4, 5, 6 hours, much less an hour, right? So only if you're instructed to do it, and you need something big enough to get that body part into without touching the sides, that you can maintain that temperature, right? 104 degree water that you put a 15-pound ice cube into is going to cool off rapidly. Whoops. So heat the water between 100 and 105. See, like I said, I've seen 104, 105. Heated water. And with any cold injury, it doesn't matter whether you're warming it up or not, you gotta get things off of those limbs. Clothing, jewelry, watches, straps, rings, okay? Because as things swell, that will also restrict temperature, restrict blood flow. Okay. Continuously stir the water if you don't have enough to do already, right? And as we complete rewarming, which is going to take a long time, dry it, put dressings on it, big padded air, I'd wrap pillows around it, anything I could do to keep that foot, as an example, protected from being bumped around. And if I can't rewarm it, I'm going to do the same thing. I'm going to wrap a big multi-trauma dressing, one of those 10 by 30 dressings around it, and I am going to put towels around it and maybe a blanket around it, and then I'm going to wrap it and tape it, and I'm going to protect that. Okay. Keep them at rest and make sure the rest of them stays as warm as possible. Don't let the limb freeze. Transport with it slightly elevated. I don't know how much of a real difference that makes, but it's in the book. All right, so exposure to heat is pretty much the same mechanisms, right? We already said those 5 ways of transferring heat and cold. And the object is to keep them at that 98-degree temperature. The thing with heat, though, is that we can cool them off. We can prevent damage. So when you get super hot, it's your brain that fries, if you think about it that way, okay? We don't have frozen body parts. We've got a brain that's being exposed to heat. So we do need to cool these folks off. So they do die. You know, hyperthermic patients die. Hyperthermic firefighters die. You know, 20-year-olds at you know, when I do a class that I have on rehab, I talk about a 19-year-old and a 20-year-old. One was in the training evolution, and he died from heat, and the other one died at a brush fire because of heat. Okay, so young, healthy, heat cramps, heat exhaustion. These are kind of the early signs, and these folks look normal. They, especially for the environment, right? They're sweaty, they might be a little pale, and their temperature is pretty much normal to cool because their mechanisms, their compensatory mechanisms, ooh, big phrase, is working. It's keeping their temperature from being lethal. So they're still sweating, they have evaporation going on, it's cooling the skin under it, but it may not be enough to get them back to normal. Okay? So these are the folks, when you recognize this, you intervene quick, right? So we can prevent heat stroke. You know, you're at that brush fire and if you guys don't have a formal rehab setup, you can walk the line, right? Walk the line and look at these people. And you see this dude who is kind of leaning on his shovel or rake, and he's sweating his ass off, and he doesn't look like he feels good. Go assess him, right? Hey, how you doing? I'm all right. Cramping up at all? Yeah, my calves are cramping, or I got a little bit of a stomach cramp going on. It's no big deal. Yes, it is. You're off the line. Let's go get you cooled down. Let's get some fluid into you. You know, you're awake, you're alert, you're oriented still. Here, drink water, right? Here's a 32 ounces of water, right? Here's a couple of 16-ounce bottles. I want you to drink these over the next 10 minutes, okay? And put them in the shade and rest them. That's usually enough, okay? And then that dude's offline. Heat stroke, those compensatory mechanisms, right? Increasing the pulse to bring more heat to the surface. Perspiration, those have failed. Okay, he's not perspiring anymore, so his skin is hot and dry. He could still be a little sweaty, but a little, and maybe it's also because of the fact that the dew point is 95%. So evaporation isn't going on, and he's just still sweaty. These guys are lethal. You know, they're dying. So we need to cool them off rapidly. So, as I was mentioning with heat exhaustion, the body does lose salt. So in the old days, like right up until probably into the 70s, the military was giving guys in these hot environments salt tablets because, you know, you're losing salt. And yes, you are. And that does cause cramping. But we were giving them too much salt, and we were throwing sodium levels completely out of whack. Well, what about Gatorade? So Gatorade has electrolytes in it. And Gatorade was developed, right, in what, the 60s or 70s with Florida Gators, right? Also Alabama and Georgia football teams in August when it's 100 degrees and almost 100% humidity, and they're doing double sessions, morning and night, with these big linemen, but with anybody. They were becoming not just dehydrated, but also depleted as far as their chemistries go. So yeah, for that, in that environment, Gatorade's probably pretty good. But for the majority of the rest of us, for this short-term event, it's just dehydration. It's like with rehab, the International Association of Fire Chiefs and all the medical directors and whatnot say no more than a 50-50 mix, because too much Gatorade will throw off your electrolytes as well. So you go from one a little low to too high, and your heart doesn't work very well there either. So so don't worry so much about this salt issue. Yeah, you do get some heat cramps with it, but when you cool them down and you rehydrate them, they're going to feel better. You certainly can have hypovolemic shock because of too much fluid loss, right, from sweating. You know, nowadays, if you're in the military and you go to Iraq in the summertime, you know, a couple of years ago, you went to Iraq in the summertime, but you go to Saudi, Djibouti, or, you know, wherever, you aren't thrown right into a patrol. You get to acclimate to the area first. In Vietnam, as an example, guys got off the airplane, got put on a truck, got taken out to their headquarters unit, and then they got put on a Huey and flown out to their line company. And hey, congratulations, it's 120 degrees. There was no acclimation. We've gotten better about this, but fire service hasn't. We can't. We're in the living room watching TV, watching football, and eating a hamburger, and 10 minutes later, we're in an 800-degree environment wearing bunker gear. Okay, so acclimatization would be nice if we could do it all the time. So with this heat exhaustion and cramps, weak, exhausted, rapid shallow breathing. Remember that when your metabolism is high, you are putting out more heat as a byproduct. So they're breathing fast, trying to get rid of some of this heat. Pulse can get weak, certainly especially if you're dehydrated, right? Sweating heavily and loss of consciousness. But these guys are still, in my mind, when you lose consciousness, we've crossed that line, right? We've crossed that line, and you may have a syncopal event, right? You know, you've been working your ass off, you're sweating, you're dehydrated, you squat down to pick something up or to tie your boot, and you stand up and, oh, too fast, and down you go, but you wake up. You're unconscious, you're into heat stroke. So get them out of the hot environment, loosen their clothing. Oxygen if they need it, certainly. Supine, sitting up against a tree. You know, you're out in the woods on a brush fire. You know, lean them against a tree. That's fine. If they're tachypnic and tachycardic and their blood pressure is a little soft, then yes, put them flat, right? Small sips of water, but they're lying flat. That's why I'm like, if they're stable enough, I'm going to set them against something. Let them start sipping off that water bottle. And you don't want them guzzling it, right? Because they'll just puke it up. So like I said, you know, a bottle or two over the next 10 or 15 minutes. Apply moist towels over the cramped muscles. That's not going to work. They're going to be jumping around fucking screaming, right? You can certainly rub those muscles, squeeze them, kind of massage them, trying to get that cramp to break. Stretch, okay? Transport. You need to get them cooled off, okay? Now, heat exhaustion. These folks are critical. You know, you get the heat exhaustion dude, and his temperature might be 100, 101. You take the temp on this dude, and he's 105, 106. Okay, he's frying brain. So we need to think ABCs, right? They certainly can be shocky, but the first thing we need to do is cool them off. Okay, rapid shallow breathing. Pulse could be normal. General weakness, they're not sweating. Altered mental status, dilated pupils, seizures. These are, you know, you get to the point where the pupils have lost control, muscular rings in the pupils, right? The irises have lost control and they're dilated. We're getting it's pretty ugly at that point. You cool packs in the neck, groin, and armpit. What's going to cool them off quicker, right? I mean, this is something I learned in Boy Scouts and the Army, and this is certainly something I do on any given day. You know, I'm at a brush fire. and the dude's got an Indian tank on his back, guess where that water's going? You know, if he's got any water in that tank, it's going on him, you know, right on it. I mean, I'm not waterboarding him, but, you know, on his core, from his neck to his feet, right? And if they're at a house, right, you've got this old guy who's been out gardening and he's unresponsive and his skin is dry and his hose is right there, I'm going to hose him down, right? That's going to work far better than cool packs. Like here in New Hampshire, water coming out of the ground from my well, I've got a deep well. The water coming out of my well in August is 55 degrees. The water in Florida, which are shallow wells and it's hotter there, okay, it comes out, well, when I filled a hot tub 2 months ago down there, it came out at 77 degrees. That's still great, right? Grandma's in her apartment and it's 105 degrees, 110 degrees in the apartment, and she weighs, you know, 110 pounds. Guess what? I'm going to put her in the bathtub. That's going to be faster, and ultimately safer. Non-rebreathers and bag if you have to. Transport once you can get their temperature down a little bit, right? Transporting is not going to save their life, and save their brain and save their quality of life. Cooling them down is. For infants and young children, lukewarm water. Yeah, because the issue here is, well, they're little, you can do this easier. Well, if you can hold me up, dunk me in the pond, I don't care. Okay? So water related, boating, all these things, right? 1, 2, 3, 4, 5, 6 of them. 5 of them involve the phrase, here, hold my beer, right? People do stupid shit boating. They water skiing, their buddies in the boat think it's funny to go faster than you are capable of going. Windsurfing, you're not technically, you know, supposed to like be flying 25 feet in the air. So when you're, and people do it, right? The more windsurf, I get friends who windsurf, you know, the more they do it, the more they need, the more extreme they need to enjoy it, right? Jet skiing, diving, scuba diving. So ABCs, these are, you know, trauma patients with drowning potential involved. So don't forget the trauma side of it. ABCs, and then do assessments, right? Look at them for injuries, look at them for other comorbidities, 12 leads, the whole works, okay? Think about, are they hot? Then you got to cool them off. If they're cold, you got to warm them up. Consider the fact that a lot of them do have alcohol and drugs on board, and they may have been in the water, underwater, right? So we got to think about drowning. So drowning, submersion or immersion in liquid. Now, what generally happens is the vocal cords and the epiglottis close to keep the water out of there, and they suffocate. So they're not bringing air in and out of their lungs. That air gets, you know, stale, right? Because you use up the oxygen. Now there's no more oxygen going out, and all that CO2 is coming back, and it's got no place to go, and you suffocate. As you die, those things relax, and you may at that point have some liquid enter the lungs, but very rarely do you have liquid water in your lungs in the early stages of drowning. They say there's 3 outcomes. You die, you don't die. Okay? And if you don't die, maybe there's no problems, and maybe you have lots of deficits. So the thing to think about when people are struggling to keep afloat is when you go to rescue them, they will try to climb up you to keep their head above water, which pushes you underwater, right? So that's why the whole throw, row, and go, right? You throw something to them. If you can't throw something to them, you row out to them in something big that they can't tip over. And finally, last and least preferred is you swim out to them. And if you do that, you gotta, you know, I mean, they teach lifeguards to go around behind them and basically put them in a headlock. And that allows you to go backwards with them so that they don't get turned around and try to climb you and drown you. Now, as they start to submerge, some of these folks will try to take one more deep breath, which is when they may or may not get some water in. Okay. You get that sealing of the airway, and again, they go unresponsive because they're hypoxic, they're suffocating. As they're doing this and they're unconscious, some of the time they will take a last breath and get a little bit of water in the lungs. Saltwater drownings, I've read, they can be far worse because you get 1 teaspoon of salt in there and the body will try to flood the lungs to try to dissipate that sodium. I don't know. It was a long time ago that I read that, but it makes sense to me. So ABCs, right? If they're not breathing, you got to start breathing for them, whether you're in the water or whether you're on dry ground. Keep in mind also, if they're in the water, if you can't verify how they got in the water, you need to think about C-spine, right? Did they dive? Did they fall out of a boat, right? So maintaining some form of spinal immobilization or spinal restriction, would be good. You may have to ventilate them harder because if their larynx is spasmed still, you're not going to get air in or out as easily. Suction, certainly. Don't delay transport. Again, assume spinal injuries. You know, if they tell you, if somebody says, no, he was just swimming out that life raft and suddenly didn't come back up, okay, I'm not worried about their C-spine. Try to keep them in line, but remember that A, B, and C comes way after S for spine. I mean, way before S for spine, right? S is a long time after. It doesn't matter whether they have a neck injury if you don't bag them, right? If you don't ventilate them, they're going to die. Diving accidents, right? Here, hold my beer. It depends on how they go into the water. If they're diving with their, you know, like a classic dive with their hands out, they're gonna have hands and arm injuries. If they go in feet first, they're gonna have that compression type injury where the heels into the ankles, into the tibia and fibulas, to the knees, to the femurs, to the hips, to the spine, right? So that axial loading, you have to think about that. Scuba, so people like, you know, I mean, I live in New Hampshire and we have people who scuba dive, but it's not super popular. We have very, very few incidences, but it's there, right? So we need to be comfortable with how this works. We also have to be comfortable with the fact that, you know, you can be scuba diving in Florida tomorrow morning at 9 o'clock. You're not supposed to do this, but you can be, and get on an airplane at 1 o'clock in the afternoon, right? It's supposed to be, I think it's 24 to 48 hours. I don't remember exactly, but you're not supposed to fly after your last dive. But you got a 4-day weekend and people want to take the most advantage of it. So we'll watch one last dive, nothing will happen. They go just a little deeper than they think they did. They come up a little bit faster than they think they did. They get on an airplane and up they go, and that bubble expands. Now they have that dive injury in the aircraft en route back to Portsmouth, New Hampshire, right? So they come off the airplane and they're sick, injured, ill, okay? So we could see that just from somebody coming home. So events leading up to it. So what have you been doing the last couple of hours? Well, I was flying home. All right, so you're having chest pain. You just flew home from Florida. Okay, oh, well, it could be a PE. Could be. What have you been doing the last couple of days, though? Oh, what did you do in Florida? Oh, man, we went diving. It was great. We did all these great wrecks. When was your last dive? This morning. Oh, right? Okay. And then the fact that these decompression things can take up to 48 hours to appear, so that you could drive home and have it happen. Okay. Signs and symptoms with air embolus. Think of it just like any clot. Oh, blurred vision though. Yeah, because you can have these up in your optic nerves and optic vessels, right? Chest pains, extremities, general weakness, possibly some paralysis, frothy blood in the nose or mouth. We go, oh my God, it's CHF. What were the events leading up to it? He was diving yesterday in Florida. He was diving yesterday in Lake Winnipesaukee. Oh, crap. Do you have any history of CHF? No. He's a dive injury. Okay. Seizures, death coma. They throw these big air embolisms, unconscious, respiratory arrest, cardiac arrest. Decompression sickness. They get these nitrogen bubbles in the joints and it hurts. They call them the bends. Fatigue. They get cranky. If my joints hurt, I'd be cranky too. But anyways, skin, modeling of the skin, numbness, paralysis, some choking, coughing, labored breathing. They act drunk, right? They're having trouble walking. Their gait is off. Again, I've talked about this before, but I think it's stupid for somebody like Mass OEMS to say, you can't walk patients. If you do, we'll take your license. And an ambulance service will go, if you walk a patient, we'll fire you. I just want them to walk across the room to my stretcher so I can see how their gait is, right? So in New Hampshire, I can do that. Hey, sir, tell you what, we've got our stretcher here at the door. You think you can walk over to it? It's not because I'm being lazy. It's because I'm assessing his gait. And his gait is staggered. He's dragging a foot. Why? Okay. Chest pain. Now, dude's having chest pain. I'm not walking him. Right? You got to use some common sense with that sort of thing. He's short of breath. I'm not walking him. He's got chest pain. I'm not walking him. Okay. ABCs, high flow oxygen. So with diving accidents, high flow oxygen, transported rapidly to the appropriate facility. So like here in New Hampshire, we don't have a lot of options. I don't remember if it's in this slide or the AEMT program. It shows a hyperbaric chamber, but it's the size of a coffin. Those are wound care chambers. They cannot do emergency care in those. So like Frisbee in Rochester, Catholic Medical Center at CMC in Manchester, right? They have wound care centers and they do hyperbaric medicine for wound care. But you can't take your dive patient there because your chamber has to be big enough to have the patient and a nurse and a doc or a paramedic or whatever their team is. So if something happens, they can treat them inside that chamber because you cannot just open the door. You take them to the equivalent of 100 feet in depth. You open that door, you'll kill them, right? So it takes time to bring them up, just like it's supposed to take time for them to come up. So you need something big enough to get them into. I've heard rumor that in Boston there's a chamber. I don't know. Groton, Connecticut there is. You'd have to put them in a helicopter and they have to worry about elevations. So what would I do? I'd call Divers Alert Network. And I'd say, hey, I'm in New Durham, New Hampshire. Where's my closest dive chamber? I have a dive injury. Okay. Divers Alert Network, 24 hours. Either supine or on one side or the other. Continue to monitor them. So rescues, like I said, you can certainly reach with an object, reach, throw, row, and go. I left out the reach part, but if you've got something long enough that you can reach out to them, you're in a boat and they fall overboard. Boats are supposed to have paddles. Okay. If you can't do that, boats are supposed to have throw cushions that are flotation devices, or you could throw them a life jacket. Okay. Row out to them, grab them, pull them over, and keep in mind it's hard. It is hard to pull somebody over the side of a boat. You may not be able to. You may simply be able to just hold on to them and get the boat back. I'm a bass fisherman, right? I spend a lot of time in a bass boat. Bass boats are low to the water. And I know a lot of people, professional anglers who are in fairly good shape, who fall out of boats and they have trouble getting back in the boats. Their clothes are wet. The water might be cold, 60, 50, whatever. And instantly they've got that kind of numb, rigid, stiff, right? Blah, blah. So like newer bass boats come with ladders that you can climb up. And a lot of times you can't do it, okay? So it's hard. Last resort, swim to them. If that water's 50 degrees and you go in the water after them, you're gonna drown. You are going to die. So reach, throw, row, go. Ice rescues. So the number one rule in everything we do is protect yourself. Again, throw, throw a flotation device, throw them a rope with a loop around it. If you can go out on the ice on something like a flat bottom boat, how do you get that out on top of the freaking ice? Oh, push it, which means that, oh, if you can push that out and get the nose of it to the edge of the open area, you know, but you're also holding onto it. So if the ice starts to break, jump in the boat. A ladder, right? Because anything that will distribute the weight on the ice. And ideally, you don't do that without a dry suit, one of the Gumby floating suits. Treat them for hypothermia. They go in the ice, they got to go to the hospital. They go through the ice, they go into the water, they got to go to the hospital. Work in teams, don't walk out on the ice. And this may be the hardest thing, is not to go and watch somebody drown. Not to go. Keep other people from running out there trying to rescue their loved one. Bites and stings, it's funny. I think it's the EMT, sorry. Bites and stings are in the poisoning chapter, but in this one, it's in the environmental. It's funny, I used to work with an ER doc who said, spiders aren't poisonous. Yeah, they are. Anyways, all spiders that bite have a form of toxin to go with them. It may be so small or so weak, you just get that little ow, right? Fire ants, holy crap. I get tagged by a fire ant my last 2 trips to Florida. I get tagged by fire ants both times, and it took almost 3 weeks for those bite sites to resolve. You wouldn't even, like the first day, you got bit, but like the second day, it would swell up and start to burn, and like my whole foot would hurt. And then over a week, it would get swollen, and it would get kind of this thick, almost like, you think about a thick rubber washer, that would be kind of the area where I get stung. And it would take a couple weeks for that to go away. Nothing cured it. It was awful. Spiders, venomous. Rarely, though, do these things hurt us. We do worry about anaphylaxis, whether it be airway, breathing, or circulation. If you can get the stinger out, do it. I don't know if I have. So if you have like a bank card, as an example, or a credit card, and you have that stinger sticking out, if you do this and you kind of grab it and scrape it, that's good. If you have it and you grab onto it, what you're grabbing onto is the venom sac, and you may pull it out, but what you'll do is you'll squeeze that venom down into the tissue and make it worse. Brown recluse, like you've heard me say, I live in New Hampshire. We have brown recluse bites here in New Hampshire because they come up in the bananas. Places that grow bananas, Central South America, lots of bananas, where we get the majority of them, there's lots of brown recluse. And they're in the bunch of bananas, and they go into the banana box, and they go onto the boat, and they come to our store, and somebody gets bit. It's not super common, but it happens. So you've got your kind of red circular area. And what you get with that is you end up getting a necrotic tissue in that area. And they end up having, a lot of times, they have to debride it. With any of these insects, you can certainly have altered mental status, the noticeable bite or sting, puncture marks, mottled skin, localized pain and itching, numbness in a limb or body part, burning sensations, hence the term fire ant. Felt like my foot was on fire. Redness, swelling, blistering. You can get weak. You remember that? So the big ones, the vipers, right? The rattlesnakes, the black widows, tarantulas, all those, they're neurotoxins. So they spread it through your bloodstream, and they attack your nervous system. Okay, so weakness, collapse, respiratory problems, headache, and dizziness. Then you can certainly get septic, chills, fever, nausea, vomiting, cramps, chest tightness, drooling, sweating, anaphylaxis, any of these things. We don't have specific protocols in New Hampshire, right? I've worked for 5 hospitals here in New Hampshire over the last 35 years. One of them has a book that lists anti-venoms, lists spiders and snakes and the anti-venoms and where they could get them. I don't think they ever saw one, right? I mean, state of New Hampshire, we do have rattlesnakes, very few of them, but we do have timber rattlers. I can't tell you the last time I heard of somebody being bit by one, though. But they get found in people's garages like every fall. They're looking for a place to winter up. Fishing game relocates them. So I'd call poison control. Our yard dogs don't know what to do about this stuff, right? They don't deal with it either, just like I don't. Poison control will. If you can remove a sting or a venom sac like I just showed you, go ahead. Get everything off that limb. Shirt sleeves, rings, watches, constricting bands. This is something I would talk to poison control about, because there are certain things that they say, oh, constricting bands are okay, and other things like, no, don't use constricting bands. So this is something I would go by poison control on. Keep it immobilized, right? If it's an arm, sling and swath. You don't necessarily need to swath it now. Sling it. Don't let them walk. Carry them out. Okay. Snake bites. While they're not usually life-threatening, though, I mean, they certainly can be. And actually, so let's say you have rattlesnakes, okay? The baby rattlesnakes are more deadly. They have the same amount of venom, of toxin, I should say, in less volume. So that bite, if it's a wet bite, they transfer venom. That venom is more concentrated. It's going to be more dangerous. Another thing with snakes, rattlesnakes I know about. I don't know about the others, but rattlesnakes, their nervous system, let's say you chop their head off, they will continue just as a nervous reflex to bite, and their poison sac is still in their head, right? So you cut a head off a rattlesnake, bury it deep, okay? So a lot of times what causes that death is that anaphylactic reaction. Now they may have a horrific time with the effects of this bite, but not usually life-threatening. It doesn't mean it's not going to suck really bad. Okay? Stay calm, keep them at rest. You stay calm, yeah, right. Pressure or mobilization bandage may be most effective technique. Again, I'd ask poison control. The bite may be hard to figure out. It may just be a little puncture. Small punctures are hard to see in people sometimes, right? 30 minutes to several hours later, you may start to have a better idea of where. And then rapid pulse, labored breathing, general weakness, vision issues, nausea, vomiting, seizures, death, coma. Medical direction. Again, poison control is a form of medical direction. They're the experts in this. This is who the ER docs call. Okay? Treat the shock, keep them warm, keep them calm. If you can find the fang marks, yeah, sure. Keep them immobilized, transport them. Now, in the United States, naturally speaking, what lives here, what's been here, what was here when the Pilgrims showed up, right? Rattlesnakes of various brands, water moccasins, also known as cottonmouths, coral snakes, and copperheads. So coral snakes, right? Is it coral, copper? Coral snakes chew. They don't have fangs. Copperheads strike. Rattlesnakes bite. Water moccasins bite. The coral snake, red on yellow, kill a fellow. Red on black, venom lack. So red, yellow, black stripes. Red on yellow, they're toxic. Red on yellow, kill a fellow. Red, black, yellow, they're a non-poisonous native snake. Okay. Now there are other snakes in the United States that are brought here illegally. So I live in this small town in New Hampshire. Across the border in Maine is a similar sized town, you know, a couple of thousand residents. Um, Back when Northwood's Law was Maine Fish and Game, they did a raid on a house in the town of Lebanon, Maine. They had a search warrant because the guy was known to keep exotics, right? Illegal pets, snakes, and he was selling them. And they had raided his house once before, and he had cobras. And that freaked me out because the ambulance service I used to work for covered Lebanon. Anyways, so there can be other exotic snakes. Take a picture of the snake. If you want to kill the snake, that's up to you. People are like, oh, I don't kill snakes. Me, I get bit by a snake, I'm killing that bastard. Don't bring it to the hospital. Take a picture of it, right? Take a picture, take the picture with you. Because dead snakes can still envenomate. Spiders, take a picture of the spider, okay? Now, marine life, jellyfish, that's the big one, right? So as far as bites go, but you can get sick from eating seafood. The seafood itself can be poisonous, or it can be prepared improperly. You know, you can get seafood, you know, food poisoning, whatnot. Stings and punctures. You know, up here it's jellyfish, and they hurt, and people go to the hospital, but they're not poisonous, they're not deadly, right? So saltwater rinse, certainly you can do that with, especially with jellyfish. Ammonia will do it. If it's your own leg, don't do this on an ambulance call, but your own leg, you could actually piss on your leg, and the ammonia in the urine will help make it feel better, okay? Which is handy because if I'm in the water and I get stung by a jellyfish, I'm probably gonna wet myself anyways. So that's the environmental chapter. It's not everything in the book. Everything in the book is fair game, but those are the main parts to this. ABCs, keep people calm, either warm them up or cool them off, protect frozen limbs. Very, very, very rarely do we thaw frozen limbs in the field, and safety. All right, so anyways, that's chapter 31. Join me again for another thrilling chapter in the EMT series. Talk to you later. Thank you.